So, good morning, everyone. Again, I want to thank all the essential employees that are out there keeping us going forward. Thank you for everything that you're doing day in and day out. You know, unfortunately, we had 2 more people pass away last night in Albany County, which now brings our total up to 61. To the 2 new families, our condolences, our prayers go out to you in this difficult time. Like I like to remind everyone, it's not the norm. When you lose somebody, you can't be with them. And unfortunately, you can't give them their last respects normally how we've done in the past. So please, when we think about these families and all 61 families in Albany County, please keep them in your prayers and thoughts, and our condolences go to you. We have a man and a woman in their 70s, both with underlying health issues. You know, so it's difficult, even though they had issues going on. And, you know, unfortunately, there were 2 residents at our nursing home, Shaker Place, that passed away. And, you know, as everyone knows, nursing homes been talked about now for the last couple of months. But it's unfortunate. So that brings six people that passed away in our hospital, and 4 that passed away in hospitals. Sorry, I said that backwards. 6 people that passed away in our nursing home, and 4 people that passed away in hospitals. So it's, you know, my heart and my thoughts go out to the workers and to the families in our nursing home. They're doing their best, and we continue to be aggressive out there with the way we're handling things. So again, keep your prayers and thoughts in the residents and for the workers that go there 7 days a week around the clock to keep people safe. So some good stuff going on. 1,363 positive cases. That's only up 18. So it's one of the things I talked a little bit yesterday on Mother's Day was about our you know, last 7 days. It seems like we're on a downslope, which I'm hoping that's going to continue. We have 847 people with under mandatory quarantine. That's down 124 from yesterday, which is great news. And we say 15 people that are under precautionary. That stays the same, but being down 124 and our positive cases only going up to 18, both great things. You know, so again, as we aggressively have been testing in this county, of course our numbers spiked up higher than anywhere else quickly, and it's good that as we continue to be aggressive with our testing that people are coming back negative, which is a good sign that they're listening to Dr. Whalen and our message about, you know, social distancing, staying home, coughing into your arm, and you know, staying isolated. So thank you to everyone that's doing what they need to do. Also, some good stuff, 3,294 people have completed quarantine. That's down 140 from yesterday. 823 who tested positive out of that number have recovered. Out of that, 10 more people have recovered since that, so which is also great news. You're seeing that number too. And unfortunately, we have 2 extra people that are now being hospitalized. We had 28 yesterday. We have 30 as of today, with a hospitalization rate of 2.2. And we still have 7 people in the ICU. So as we talk about that going forward and everything else, and we're going to be talking about our dashboard here, I do want to remind people about the mobile testing being done down in Queens Ravina, and also about our mobile testing number, as always, when we put it up, area code 518-465-4771. And, you know, our mobile testing sites have given out 995 tests in Albany County sites so far, which is good. And with every other thing going on in the Rite Aid site and the site in Gilliland, that brings our testing up to 1,600, which is, you know, again, being very aggressive, and we're going to continue to go down that road. And again, you have to go to the riteaid.com website and sign up there. And as always, you can call the Priority 1 Urgent Care in Gilliland. You know, so these are good things that we've been doing. And like I said yesterday when we talked about the reopening plan, you know, the governor's going to be addressing a lot of stuff today at 11:30, so we're going to be looking forward to hearing what he has to say, and we're going to look forward to submitting our plan. So, you know, these are all good things, and, you know, again, we want to open up in a safe manner, like I said yesterday, and we want to make sure we protect the residents first and foremost. So, but as our hospitalization numbers continue to go down, our positive cases go down, the people on quarantine continue to come off, these are all good things. But again, I want to remind everyone, like I did yesterday, we have to open up in a safe way that protects the people. Other people have opened up. If you open up too quick, you'll see a spike in that, and we're going to be taking a lot of guidance from not just our health department here, from Dr. Whalen's team, but from all the health departments in the other counties, working in conjunction to make sure that we do this in a safe manner. Because again, the health and safety of our residents is first and foremost with all of us. One of the things on the the dashboard's up. Now, I'll let Liza explain it. But one of the things I want to point out on the dashboard that I'd like to remind everyone about is the age bracket. Again, just want to grab my sheet there. So the age bracket of the 20 to 29-year-old, you see a spike in the numbers, and it's almost positive cases almost as much as the 50 to 59-year-old. So again, that's kind of alarming to that factor, that them two age brackets are continuing to go up. So we're going to continue to look at that as we do testing and mapping going forward. But who better than to talk about it than our great health commissioner, and happy Mother's Day again.
Thank you.
Dr. Whalen.
Thank you. Good morning, everybody. Before I get to the data, I just want to talk about a couple of updates on the county level of state initiatives that have been launched in the past week or so. First of all, I think everybody's heard a little bit about the contact tracing, the Army of Contact Tracers. Now, all of you are aware that at the local health department, we have our own Army of Contact Tracers who from day one have been following all the cases, ensuring that we have contacts, ensuring that people are isolating at home when sick, and ensuring those that are in contact with ill individuals undergo a mandatory quarantine. But in conjunction with the governor's mandate that we need to have a certain amount of testing, we are looking to partner with the initiative that's been set up through the Bloomberg School of Public Health and the training module at Johns Hopkins. And our staff is going to be this week doing a similar training that has been created for local health departments to ensure that when those additional resources at the state level are brought to the county, that we're all on the same page. This will also include a database that can be worked off of so that everybody's operating from the same playbook, and we'll be updating staff on that and having more training, and I look forward to those additional resources going forward. The second thing that I wanted to discuss was the news over the weekend about additional testing being done at the nursing homes. And we started working last week with our nursing home and with all the nursing homes in Albany County to ensure that we are able to test all residents and staff. This is, as of yesterday, the mandate is that all residents and staff will be tested twice a week. This is a good development, but it's also a very large undertaking. So we have a call today with our nursing homes to try to start the discussion around the practicalities that will be involved in doing that, and I will share more information on that as we move forward with that. So getting into the data that we have on our COVID dashboard, this was last updated May 10th, yesterday at 6 p.m. I'm going to start at the bottom today. I think this may be where I want to start because it's a little bit reassuring when you look at the number of daily positives. We, last week, or a couple weeks ago, we're starting to see numbers rise a bit, and now we're seeing them drop off. So this is good news. We're seeing less positives of the people that are tested in the county, and we look forward to continuing that trend and hopefully continuing to see those numbers drop off. From a geographic area, we continue to see the most cases in 12203 with 184 cases. And again, if you go into the dashboard, you can do an interactive look at that to determine where your particular zip code may be on those numbers. As the county executive pointed out, we still see the highest trends in the ages of 20 to 29, and 50 to 59 are our highest group of positives tested. We continue, and I'll go back to the racial demographic data above. We continue to see large numbers of people being tested. 455 were tested on the 9th. This data is from the state, which is a little bit of a lag from ours. Up to date, we've had 14,186 residents in Albany County tested, and out of those 1,432, again, the state's data is a little bit different than us, but the percent positive is around 10.10%. And if you look at that from a daily trend perspective, as we did for Albany County, we see the trend is starting to trend down. If we go back to our data here and go back to the first chart, which is what we discussed before, the age and racial demographic information. It's a bit busy to look at, but if you look at the county demographics, these indicate the percentage of male, female, and by age group. If you look at this number and then go back and see if a number is higher than what we would expect for county demographic, that's how we know that there's a disproportionate effect. So when we look at this, we see, for example, that men are hospitalized more commonly in the ICU than women. The male-female break is 50 to 50% in the county, but it's 59.6 versus 40.4 for male versus female in the ICU. Hospitalization, male slightly higher. Current hospitalization, male slightly higher. Looking at the age demographics, again, we see the highest percentage of positives in the, and including those that are hospitalized, in the 50 to 74 age range, which makes up 29.3% of the Albany County population. It makes up 73% of those ever in the ICU, 56% those hospitalized, ever hospitalized, and 46% current hospitalized. So we see that this and the older demographic of 75 plus are the disproportionate share of those that are both hospitalized and in the ICU. And then if we look at the racial and ethnic factors, we also see that there's a disproportionate effect. The African American population is 11.4% of the county demographics, but makes up 28% of ever ICU, 23% ever hospitalized, and 20% of the deaths. So we continue to see that disproportionate burden of disease and death in the African American population, and we're working to ensure that we have testing available and education available across the county and to all demographics to make sure everybody is aware of what they can do to prevent their risk and to be tested if they need to.
Thank you, Dr. Whalen, as always, and we'll continue to trace everything so we can get to the bottom of, again, to people in the county that it's affected more than others, and as Dr. Whalen said, through education and obviously getting into these communities and making sure that we address this issue going forward and continue to address it even when this emergency is over with. Again, I want to remind everyone the mental health support line is available 7 days a week, 8 a.m. to 8 p.m. The number's up, as always, and then the 24-hour sexual assault hotline, area code 518-447-7716, 518-447-7716, and as always, the 211 and the New York State hotline. Again, I want to thank all the workers in the county that continue to come every day and you know, helping us out to continue to go forward. I want to say thank you to all the county workforce and to all the people, again, that continue to have to come to work every day to keep us moving forward. So thank you.